And we also look into the human rights issues on the menstrual health and hygiene.
Now, yes, Mr. Cham, how many students and teachers attended this training, and what have been their motivation in attending this particular program?
Okay, the training was attended by 50 participants, where we have 45 being students and also, let's say, 5 being teachers, female teachers, and also ancillary staff that normally help in the school. The training was meant to address issues of, let's say, issues of menstrual health in schools. Like the training was meant to provide them key information on how to properly manage their period at school, and also the privacy to change the use pads, and also look into providing training them on period management and also production of parts as sustainable ways to end, let's say, the period poverty. We also equip them to be open-minded when it comes to menstrual health hygiene. The training also look into and mark a start of a human rights campaign to address the issue of menstrual health hygiene in school, whereby we are now advocating, we start the advocacy for availability of standard toilet facilities in schools to be used to allow the students and also some of the children at the upper level to be able to manage their periods with the required material and the privacy also that is needed in in this. And we also look into issues of the stigma and the discrimination. Okay, yes. Those were some of the things we were trying to address.
Now, talking about those issues that you are trying to address, how significant is this training in improving students' understanding on menstrual health and hygiene, especially as it relates to the school systems?
Yeah, I think the training was very significant and important because when it comes to the public health issues, like the usage of the pads and the number of pads to be used per day and the disposal methods, and also how to avoid bacterial infection, and also when to report to a hospital, and also signs and symptoms of some complications that need medical attention were all discussed during the training.
Earlier on, Mr. Cham, you have mentioned about stigma and discrimination that is attached to people or girls who are experiencing this sort of change in their life cycle. What, in your own understanding, what is making people to stigmatize or perhaps discriminate people, especially these girls, as they are undergoing these transitional phases in their life cycle?
During the training, we realized that some of the participants could not even openly discuss or admit to accept this period as something that is normal. And most of the time, the taboo that is associated with it also is a way in which it is also disturbing them and also causing so many problems for them at home, whereby sometimes concentration to concentrate in class while they are seeing their periods become difficult for some of them. And it also puts some of them under stress. So these are some of the things that we are also look into. And we also get into the issue whereby we try to normalize the status of the menstrual health hygiene among the participants, and also equip them to affordable local sanitary pads, because they were trained on how to make a local sanitary pad that can be used at their disposal.
Now that the training is done and dusted, how would you describe the performance of the students and those who attended the program, especially in their understanding of these menstrual issues surrounding girls' development cycles?
Yeah, I think we have at least addressed some of the issues that they were unable to discuss because in this we partnered with Fatima's Part Drive, who focus on ending period poverty and stigma and discrimination for women and girls. And she was able to engage them. They were able to at least discuss some of the things that were disturbing them and some of the things that they do not want to share. And most of the things that they kept private regarding these issues were also disclosed. And I think it was a starting point for the advocacy in ending the discrimination and also stigma attached to discrimination.
And finally, Mr. Cham, what would be your message to parents as well as teachers, especially how to treat these girls as they continue their development phases in their life cycle, especially as they are going to school?
Yeah, I think it's very important, especially at the school level, for administrators to at least provide the availability of toilet facilities in schools that can be used to allow these children to manage their periods while they are in school. And also the taboo-related issues attached to some of these things should also be looked into. Parents should also be not put that stigma and also that stress related to this thing in terms of culture and also the taboo in when it comes to the menstrual periods of these children at home.